Seniors, 5 reasons. Your legs are getting weaker after 60. Do this before it's too late. It is a common misconception that declining leg strength, persistent shakiness, or an overwhelming sense of fatigue in your lower limbs as you age are simply an unavoidable facet of growing older, an inevitable tax levied by the passage of time. However, the sobering truth, often overlooked in the daily hustle and bustle, is that weakening legs are far more than just a minor inconvenience or a trivial sign of advancing years. They represent a crucial, often urgent, warning signal emanating from your body, indicating a significant and potentially serious underlying issue that demands attention. This could be anything from a gradual erosion of muscular power, a compromised circulatory system struggling to deliver vital sustenance, or even a deficiency in essential nutrients that are fundamental to bodily function. To dismiss these symptoms, to label them as mere old age, is to tragically overlook a critical message, setting the stage for a cascade of increasingly detrimental outcomes. The consequences of such neglect can range from a heightened risk of dangerous falls, which can severely impact mobility and independence, to a profound loss of personal autonomy and, in severe cases, even life-threatening medical complications that can drastically diminish your quality of life. Yet, amidst this potentially alarming reality, there is a reassuring and empowering truth. Once the veil is lifted, once you gain a comprehensive understanding of the multifaceted, often hidden causes contributing to this unwelcome leg weakness, you are then equipped with the knowledge and capacity to implement straightforward, effective strategies. These actions can meticulously rebuild lost strength, restore vital stability, and reestablish a sense of confident, unburdened movement, allowing you to navigate your world with renewed vigor and self-assurance. Let us embark on a comprehensive exploration to uncover the 5 most prevalent and impactful reasons why your legs might be progressively weakening as you enter and advance through your 60s, and crucially, delve into actionable, preventative, and restorative measures you can integrate into your life to effectively address these challenges long before they spiral into irreversible complications. Please remember, the entirety of the information presented here is meticulously crafted for educational, enrichment, and general awareness purposes only, and under no circumstances should it be construed or substituted for professional medical advice, diagnosis, or treatment from a qualified healthcare provider. Our journey begins with what is arguably the most common and fundamentally impactful culprit behind diminishing leg strength in later life: muscle loss, medically termed sarcopenia. This insidious process of muscle degeneration is, unfortunately, a natural and inherent aspect of human aging, commencing far earlier than many might imagine, often subtly beginning its destructive work as early as our 3rd decade of life. However, it is upon crossing the significant threshold of 60 years that this physiological decline accelerates with alarming rapidity, transforming from a gentle erosion into a more forceful and noticeable decay. If proactive measures are not consciously adopted and consistently integrated into one's lifestyle to directly counteract this relentless muscular attrition, the implications are stark. An individual could face the staggering loss of up to 30% of their total muscle mass by the time they reach their 80s. This substantial and often insidious diminishment of muscle tissue directly translates into a profound weakening of the legs, rendering a multitude of once effortless daily activities increasingly arduous and daunting. Simple actions like the seemingly trivial act of rising from a comfortable chair, embarking on a moderate distance walk, or ascending a flight of stairs can transform from routine movements into monumental struggles, demanding immense effort and often leaving one feeling disproportionately exhausted. The telltale signs of sarcopenia manifest themselves in various subtle yet pervasive ways, often beginning with a noticeable thinning of the thighs and calves, giving the legs a less robust appearance. Accompanying this physical change is often an inexplicable sensation of heaviness within the legs, as if they are weighed down by an unseen burden, even after minimal exertion. Perhaps most frustratingly, an overwhelming and persistent sense of fatigue can set in after what would typically be considered only a short, undemanding stroll, indicating that the muscular reserves are significantly depleted. The encouraging news, however, is that this trajectory of muscle loss is not an immutable fate. Sarcopenia can be significantly slowed, and in many cases, even partially reversed through dedicated and consistent effort. The cornerstone of this reversal strategy lies in the intelligent integration of simple yet profoundly effective strength-building exercises into your daily regimen. Activities such as chair squats, which are highly adaptable and require no special equipment, targeted leg lifts that can be performed while seated or standing, and resistance band exercises, which offer adjustable levels of challenge, are powerful tools for systematically rebuilding lost muscle fibers and enhancing overall leg power. Beyond physical exertion, the role of nutrition is paramount. Adequate protein intake is absolutely essential for muscle repair, regeneration, and growth. Therefore, making a conscious effort to regularly consume lean meats, eggs, fish, dairy products, nuts, and legumes provides the vital amino acid building blocks necessary to fuel this critical muscular renewal. Crucially, the importance of consistent movement, even if seemingly modest, cannot be overstated. Even a dedicated 10 to 15 minutes of walking each day acts as a potent stimulus, helping to keep your leg muscles actively engaged, primed, and robust, thereby staving off the relentless march of atrophy. This multifaceted approach, combining targeted exercise and intelligent nutrition, forms a formidable defense against the debilitating effects of sarcopenia, empowering seniors to maintain strength and mobility. Moving beyond muscle mass itself, the efficiency with which your body delivers vital resources to those muscles becomes our next crucial area of focus. Poor circulation, often symptomatic of peripheral artery disease, PAD. Have you ever experienced a disconcerting sensation of coldness in your legs, a persistent numbness, or the sudden, debilitating grip of cramps that seem to seize your muscles exclusively when you are walking? These seemingly innocuous sensations could, in fact, be clear and compelling indicators of compromised blood flow to your lower extremities, a condition frequently attributed to the gradual yet dangerous accumulation of fatty plaque within the arterial walls, a vascular ailment known as peripheral artery disease, or PAD, when the intricate network of arteries responsible for nourishing your legs becomes constricted or partially blocked by this atherosclerotic plaque. The delivery of oxygen-rich blood and essential nutrients is severely impeded. The direct consequence of this circulatory deprivation is that your leg muscles, starved of the vital fuel they require, progressively weaken, succumb to an overwhelming and premature fatigue, and become alarmingly prone to painful, involuntary cramping episodes, often triggered by even moderate exertion. In more advanced and severe instances of PAD, where blood flow is critically compromised, the lack of adequate circulation can tragically hinder the body's natural healing processes, leading to the slow, agonizing development of chronic, non-healing wounds, particularly on the feet and lower legs, which can unfortunately become fertile ground for serious, potentially limb-threatening infections. If you routinely find your legs feeling uncharacteristically heavy or experiencing a persistent tingling sensation after periods of standing, or if you encounter a characteristic pain in your calves that consistently eases and improves once you cease activity and sit down to rest, these are powerful red flags suggesting that your peripheral circulation may indeed be significantly compromised and warrants immediate attention. To proactively boost and invigorate your blood flow, a consistent program of daily walking is remarkably effective. Even if initially limited to short circuits around your home, this gentle, rhythmic movement acts as a natural pump, encouraging circulation. Maintaining optimal hydration is also critically important. Drinking ample quantities of water throughout the day contributes significantly to blood viscosity, making it easier for blood to flow freely. Simultaneously, reducing your dietary intake of salt, can help to mitigate fluid retention and prevent uncomfortable swelling in the legs and ankles, which can further impede circulation. Indulging in warm foot soaks can provide temporary relief by promoting vasodilation, while regular gentle massages can stimulate local blood flow. Elevating your legs above heart level for short periods can also aid venous return and reduce pooling of blood. However, it is absolutely imperative that if these symptoms persist or worsen, you seek immediate consultation with your doctor. Untreated PAD carries significant elevated risks, dramatically increasing your susceptibility to grave cardiovascular events such as heart disease and debilitating strokes, underscoring the critical need for early diagnosis and intervention. Our exploration now shifts from the circulatory system to the intricate network responsible for transmitting sensory and motor signals throughout your body. Nerve damage, commonly referred to as peripheral neuropathy. Does the sensation in your legs or feet often feel abnormal, perhaps characterized by a persistent tingling, a disconcerting numbness, an unsettling burning sensation, or even a strange feeling as though you are perpetually walking on a soft, yielding sponge? These peculiar and often discomforting symptoms are compelling indicators that you may be experiencing some form of nerve damage, a condition known as peripheral neuropathy. This widespread neurological disorder, unfortunately, impacts a significant proportion of the senior population, affecting nearly 1 in 3 individuals, particularly those who have pre-existing conditions such as diabetes or suffer from specific vitamin deficiencies. High blood sugar levels, a hallmark of uncontrolled diabetes, are particularly detrimental to nerve health. Over extended periods, elevated glucose can inflict severe and irreversible damage upon the delicate nerve fibers, impairing their ability to transmit signals effectively. Concurrently, insufficient levels of crucial nutrients, most notably vitamin B12, which is absolutely essential for the maintenance and repair of nerve cells, can also directly precipitate leg weakness and exacerbate neuropathic symptoms. The longer peripheral neuropathy is allowed to progress without appropriate medical intervention and management, the more severe and widespread its manifestations become, potentially leading to critical issues with balance and coordination, thereby dramatically increasing the risk of dangerous falls and subsequent injuries. To diligently protect the integrity of your peripheral nerves and mitigate the progression of neuropathy, several proactive measures are paramount. For individuals with diabetes, scrupulous monitoring and meticulous management of blood sugar levels are non-negotiable, forming the bedrock of nerve preservation. Additionally, incorporating a diet rich in vitamin B12 is vital. This includes regularly consuming foods such as eggs, dairy products, and nutrient-dense leafy greens. Conversely, it is equally important to assiduously avoid excessive alcohol consumption, as alcohol is a well-documented neurotoxin that can significantly worsen existing nerve damage and accelerate its progression. Gentle leg and foot massages can offer symptomatic relief, improving localized circulation and potentially enhancing nerve function by stimulating the surrounding tissues, thereby reducing discomfort. However, if you detect the onset of persistent numbness, a worsening of tingling, or any other ongoing and concerning changes in sensation, it is absolutely crucial not to dismiss these warning signs. Instead, make it an immediate priority to consult with your doctor. A timely and thorough medical evaluation is essential for proper diagnosis, identification of underlying causes, and the initiation of an appropriate and effective treatment plan tailored to your specific condition, helping to preserve nerve health and quality of life. Our investigative journey continues upwards, focusing on the central support structure of your body. Spinal problems, including sciatica and herniated discs. It might not be immediately apparent, or perhaps you haven't given it much thought, but the robust health and structural integrity of your lower back play an absolutely pivotal and often underestimated role in maintaining the strength, stability, and overall functionality of your legs. The complex network of nerves that control leg movement and sensation originates in the spinal cord and travels down through the lumbar and sacral regions of your spine. Therefore, any compromise to this delicate neural pathway in your lower back can have direct and profound repercussions on your lower limbs. If you are grappling with conditions such as a herniated disc, where the soft, jelly-like center of an intervertebral disc protrudes and presses against nearby nerves, or spinal stenosis, a narrowing of the spinal canal that can compress the spinal cord and nerve roots, or even if you have maintained a long-term pattern of poor posture that chronically misaligns your spine, any of these factors can exert undue pressure. This pressure can effectively pinch or irritate the sensitive nerves emanating from your spine, leading to a cascade of debilitating symptoms that directly impact your leg strength and comfort. The most common and telltale symptoms of leg weakness originating from spinal issues often include a characteristic pain that doesn't stay localized, but rather radiates persistently from your lower back, extending down into one or both of your legs, sometimes following a distinct pathway known as sciatica. This can be accompanied by unsettling sensations of numbness or a pins and needles feeling in your feet, or a disconcerting awareness that one leg feels distinctly weaker or more cumbersome than the other, often leading to a noticeable limp or an altered gait. If these descriptions resonate with your personal experiences, proactive measures are essential to alleviate pressure on your spinal nerves. Incorporating gentle, targeted back stretches into your daily routine can be immensely beneficial. Exercises such as the knee-to-chest stretch, which gently flexes the lumbar spine, or seated spinal twists, which promote flexibility and circulation, can help decompress the nerves and relieve tension. It is equally important to consciously avoid prolonged periods of sitting, as this posture can exert significant and sustained pressure on the delicate structures of your lower back, exacerbating nerve compression. If your lifestyle or work demands extended periods of sitting, make it an absolute priority to utilize a supportive lumbar cushion. This seemingly simple device can help maintain the natural curvature of your spine, reducing strain. Furthermore, irrespective of how comfortable you might feel, make a strict habit of getting up and moving around every 30 minutes. Even a brief walk or a few simple stretches can significantly alleviate pressure and promote better circulation. Maintaining a healthy, strong, and flexible spine is not merely about back comfort. It is an absolutely fundamental and non-negotiable prerequisite for ensuring the enduring strength, agility, and overall vitality of your legs, preventing a host of debilitating symptoms that can severely impact your mobility and independence. Finally, we delve into an often overlooked yet critically important aspect of neuromuscular function: electrolyte imbalance, particularly deficiencies in magnesium and potassium. Have you ever been abruptly awakened in the dead of night by the excruciating, involuntary spasm of a sudden leg cramp, a sensation that can be both terrifying and intensely painful? Or perhaps you've noticed that your legs feel inexplicably shaky or remarkably weak, seemingly out of nowhere, without any prior exertion or obvious cause. These bewildering and disruptive symptoms are frequently indicative of a critical shortfall in key minerals, specifically magnesium and potassium, both of which are absolutely indispensable for the proper, harmonious functioning of your muscles and nerves. Potassium, a vital electrolyte, plays a crucial role in nerve signal transmission and muscle contraction. When its levels drop below optimal, it can precipitate uncomfortable muscle spasms, a pervasive sense of weakness throughout the body, and even in more severe cases contribute to irregular heartbeats, underscoring its profound systemic importance. Similarly, a deficiency in magnesium, another essential mineral, can lead to a range of neuromuscular dysfunctions, including involuntary muscle twitching, a debilitating and persistent fatigue that defies rest, and surprisingly, can even manifest as symptoms of anxiety and restlessness, highlighting its broad impact on both physical and mental well-being. These mineral imbalances often stem from a combination of factors, including inadequate hydration, where the body's fluid balance is disrupted, and electrolytes become diluted or excessively excreted. Certain medications, particularly diuretics, often prescribed for blood pressure management, can inadvertently deplete these vital minerals from the body. Most commonly, however, the root cause lies in a simple yet pervasive oversight, not consistently consuming a diet rich enough in these essential, mineral-dense foods. To proactively restore and maintain a healthy electrolyte balance, a conscious and sustained effort to increase your dietary intake of potassium-rich foods is paramount. This includes regularly incorporating bananas, vibrant oranges, nutrient-packed spinach, and creamy avocados into your meals and snacks. For addressing magnesium deficiency, excellent dietary sources include crunchy almonds, luxurious dark chocolate, wholesome whole grains, and a variety of beans, all of which offer substantial magnesium content. Beyond diet, it is absolutely critical to prioritize drinking plenty of water throughout the day, ensuring consistent hydration, as dehydration is a significant factor that can both cause and exacerbate these mineral deficiencies, making existing problems much worse. If you frequently find yourself suffering from the torment of nocturnal leg cramps, a soothing and therapeutic warm Epsom salt bath before bedtime can offer remarkable relief. The magnesium in Epsom salts is readily absorbed through the skin, a process that helps to relax muscle fibers, soothe tense tissues, and effectively prevent the onset of disruptive cramps, providing a natural and comforting solution. Addressing these mineral deficiencies is a straightforward yet profoundly impactful step towards ensuring robust muscle function, stable nerve signaling, and overall physical vitality, making your legs feel stronger and more reliable. In conclusion, it is unequivocally clear that weak legs are not merely an unwelcome inconvenience to be tolerated or a trivial sign of advancing age that can be safely ignored. Instead, they stand as a potent, unambiguous warning signal from your body, a clear call for attention, indicating that something fundamental requires intervention and care. Whether the underlying cause stems from the inexorable process of muscle loss, sarcopenia, compromised blood flow due to poor circulation, peripheral artery disease, insidious nerve damage, peripheral neuropathy, structural challenges within the spine, such as sciatica or herniated discs, or an often overlooked yet critical electrolyte imbalance, deficiencies in magnesium and potassium, the empowering truth is that a spectrum of simple, natural, and highly effective solutions exists to help you systematically regain lost strength, restore vital stability, and significantly enhance your overall mobility. The most crucial step, however, is to take decisive action today without delay. Embark on a journey of consistent, gentle exercise daily. Even a commitment as modest as 5 minutes can initiate profound, positive changes, gradually building stamina and strength. Prioritize a nutrient-dense diet, focusing on increasing your intake of lean protein and other essential nutrients to actively fuel muscle repair and regeneration. Make conscious efforts to drink more water throughout your day, ensuring optimal hydration, and consciously balance your mineral intake to proactively prevent the onset of weakness and cramps. Pay meticulous attention to your posture and the overall health of your spine. Adopting good ergonomic habits and performing gentle stretches can prevent painful nerve compression issues. Integrate daily walking into your routine. This fundamental movement is not only excellent for improving circulation throughout your lower limbs, but also acts as a powerful preventative measure against leg fatigue and weakness. Do not succumb to the temptation to wait until these symptoms escalate, until the challenges become overwhelming, or until the point where intervention becomes significantly more arduous. The time for action is now. By embracing these holistic strategies, you empower yourself to navigate your later years with greater strength, confidence, and independence, ensuring your legs remain robust partners in your journey through life.